Hi Burst TV, my name is Kristy Antonopoulos, registered dental hygienist and Burst ambassador, and today I'm here to talk to you about dental hygiene instrument sharpening. Everybody's favorite task. I work in private practice and I also sharpen hygiene instruments for offices both near and far, so I know this is something that's not always on the top of our priority list. You know that dull instruments can interfere with our ability to scale a patient thoroughly and comfortably, but one thing you have to take into consideration is the possible long-term damage you are doing to your body if your instruments are dull. Here are my top 10 sharpening tips. Tip number 1, sharpen at first sign of dullness. I can't stress this enough. You know that every time you use your instrument, every time it's autoclaved, the edges become rounded. Tip number 2, make time. I realize this is probably the hardest tip, but when you schedule that time into your day, into your week, or your month, you're guaranteed to get it done. Or maybe you need to discuss this with your boss or your office manager. Let them know that this needs to be a priority in order for us to do our best job. Tip number 3, get to know your instruments. You as the hygienist, you need to be aware of all the different types of instruments you have and all of its parts. Specifically remembering where the terminal shank is, the face of the blade, and the cutting edge. Tip number 4, if you're not feeling confident about sharpening or you're afraid you're going to screw your instruments up, you're not alone. I hear this all the time. Try a guide. There are so many options out there for you. There is the PDT Gleason guide, and there's motorized sharpening system like the Hufridi Sidekick. But remember, you have to use these at first sign of dullness or else they're not going to be as effective. I love the idea of a guide in an office that has multiple hygienists. That way, when you guys get new instruments, everybody's on the same page and there's very little room for error. Tip number 5, test your instrument on an acrylic test stick before and after. This decreases my sharpening time because at the beginning, I'm able to figure out exactly which part of the blade needs the most attention, and afterwards, when you hear that ping, you're ready to go. Tip number 6, there are several different ways to hold your instruments when sharpening, but remember the hand that is holding the instrument should not move. So have a sturdy grasp. You can place it on top of your table for stability or even press it up against a table to make sure it does not move. Tip number 7, remember your clock. I'm going to take you back to hygiene school. I'm sorry, don't be mad at me. With a right-handed clinician, you want to remember with universals, your terminal shank should be at 12 o'clock and your stone should be at 3 minutes before or 3 minutes after. And with Gracie's, your terminal shank should be 3 minutes before 12 o'clock and your stone should be 3 minutes after. Tip number 8, remember that the Gracie blade is straight and not curved. To me, Gracie seemed to be the easiest to sharpen, but it's so easy to forget which side the cutting edge is as soon as you take that instrument outside of the mouth. So the tip I have for you here is that your odd end of the Gracie, the toe should be pointing you, and your stone will find the cutting edge. Your even end should be away from you and your stone should find the cutting edge. Again, this is if you are a right-handed clinician. Tip number 9, clear the stone of any sludge in between your sharpening. The sludge decreases the effectiveness of the stone. Tip number 10, remember that chairside sharpening is always an option. Remember that your stone needs to be sterilized and can be kept at the op. You can also put stones inside your cassette so you're ready to go. Dentistry can be very demanding on our bodies. Take care of yourself. You are worth it. Remember to work smarter, not harder, and stay sharp, Bursties.